where during a meeting that brought together international and local medical experts in surgery and oncology to conduct and discuss breast reconstruction and aesthetic surgery at the Kenyatta University Teaching, Referral and Research Hospital, the need to ensure more patients are aware of post-breast removal surgery and sustainable funding was emphasized. Now, our reporter Yvonne Kemuma was on ground and filed the following report.
During a symposium at the Kenyatta University Teaching, Referral and Research Hospital, KUTRRH, medical experts from both local and international institutions gathered to conduct and discuss breast cancer aesthetics and reconstruction surgery, emphasizing the need for increased patient uptake while commending the Social Health Authority program for covering part of the cost.
Something I would like to highlight is the role SHA has played, especially this year. We've seen that SHA has really committed to these procedures. Before, we were not having assurance that they would be covered. So it would be a hit and miss, or you are not sure whether when you put the pre-authorization that procedure will actually be approved for the surgeons to actually do the procedure.
According to Dr. Anthony Kamau, the Acting Director of Clinical Services, there is still much to be done in improving early cancer detection.
And I say the statistics are not good. A lot of women come with late breast cancer, and because of that, most of them end up having to do mastectomies, that's removal of the breast. And of course, now the sequel or the after that is then the reconstruction and the aesthetics that are done by the plastics and aesthetics team.
While comparing the state of breast reconstruction services in Kenya and other countries, Dr. John Paul Ogalo noted that more and more patients in the country are able to access surgery more easily through the Social Health Insurance Program.
What we found out was about anywhere between 5 to 10% of the patients who have their breasts removed because of breast cancer end up getting a reconstruction. So our challenge now is to increase those numbers so that we get majority of our patients undergoing the breast reconstruction, or at the very least being offered the option of having a breast reconstruction done. That's usually the bare minimum. They need to know that this service is available.
The biggest challenge is availability of that knowledge to the patients. So some patients are not aware that reconstruction. Some are not so sure whether they want to have it. And also the availability now of the resources of being able to pay upfront or to pay through NHIF.
The journey is never easy, but I think where Kenya is at the moment, or this hospital is at the moment, I think back in Ghana, my hospital, we were at this point about 9-10 years ago. And the traction will come very quickly, and it seems there's a lot of acceptance. The key, as has been said by the other speakers, is early diagnosis, and then they are initiated into a pathway of treatment, which would include breast reconstruction.
Although concerns have been raised about the low number of patients returning for breast reconstruction, healthcare providers at KUTRRH have reaffirmed the availability and access of these services. Yvonne Kemuma, KUTV.